Beautiful people. Hi everybody, good morning, good evening. Welcome back to Beautiful People. My name is Dan Stedler and I'll be your hostess. Okay, this is another awesome hospice video. Okay, as you guys know, I'm a hospice nurse and I love my career. Before we get started, I want to remind everybody to please like and share. Okay, like the video and share. This is your way of helping the word to go around. Okay, I know hospice might not be a popular topic, but it is something that is real. Okay, today's society, there's so many fake things going on. There's so many things that's really not gonna help you in life. Okay, that's not really real. But this topic, everybody at some point is going to be caring for somebody who has a terminal illness. Okay, everybody at some point is going to be at end of life. All right, so please share and because this is a great topic. This is a great way for us to know more about what happens at the end of life. How can I care for my loved ones at the end of life? Okay, so please support me, support the topic, and support your fellow hospice nurses out there. Okay, I love you guys. That being said, let's get started to the video. Thank you for your time. This is going to be another hospice video. All right, I'm super excited. If you guys didn't know, I have a playlist. Okay, go on my page, click on the playlist. I have several videos about hospice care. Okay, and it could be a useful tools for my fellow healthcare providers who are out there who's curious about getting to know hospice. For a nursing student, if you're a nursing student, you are in nursing school and you're not sure which way to go, look at my videos. They're very informative. If you are a caregiver, okay, or if you are a person who has newly been diagnosed with a terminal illness, these videos are also all informative for each and every one of you. Everybody can benefit from watching the videos. Okay, once again, I am a registered nurse. I'm a registered hospice nurse. Okay, and in my videos, my previous video actually talked about the reason why I chose to be a hospice nurse. I also have a hospice book that I wrote, and it's on Amazon right now. So hospice is definitely dear to my heart. Okay, today we are going to talk about dementia, Alzheimer's dementia eligibility. Okay, what would qualify somebody to get onto hospice care with an diagnosis of dementia. Okay, so please stay tuned. All right, we are going to break it down. Okay, and once again, these are based on my personal experiences, and also they are based on criterias that we have to follow. We have special guidelines and criteria that Medicare, who mostly reimburse us, needs us to follow in order for the patients to get onto hospice. Okay, but always, like I've always said in my videos, follow the guidelines, follow the criteria of your local hospice provider. Okay, and of course your PCP, your primary physician, your doctor. Okay, so that being said, let's get started. Unlike being diagnosed with a diagnosis such as cancer, it's a bit trickier for us hospice professionals to put somebody under hospice care with a diagnosis of dementia, Alzheimer's. And the reason, my Duns beautiful people, the reason is because with Alzheimer's and dementia, and some of you who has cared for loved ones or who are currently caring for a loved one with dementia, is that their condition, okay, their health conditions goes up and down, okay? It's like a bell curve. It goes up and down. Some months, they could go months doing really well, eating fine, having no infections, staying out of the hospital. And then other months, it could be complete opposite. Okay, so that's the reason why sometimes it's difficult for us to put somebody under hospice care with dementia. And the hospice nurse will probably say, or the hospice physician will say, let's wait a few months. Let's come back in 3 more months to reevaluate the person, okay? But that being said, I'm going to go over what specific, the main criteria, the main topics, okay, the main factors that the physician would be looking for, and that especially Medicare, because like I mentioned, Medicare, is mostly who pays us, okay, who pays hospice. So they give us certain guidelines, okay, and to follow to put somebody under hospice care, okay? So some of the things that would qualify your loved ones, if you have a loved one and you're thinking about, is hospice care good for them? Should I call my local hospice? So the first thing, well, these are not in any particular order, okay? I'm just gonna go over them as they come to my mind, okay? The first thing would be if your loved one is losing weight, okay? That is a major thing, all right? If they have lost at least 10% of their body weight in the last, say, 3 to 6 months, okay? If they have lost at least 10% or more, okay? If they have stopped eating, okay? Or if they went from eating 100% to maybe now eating just 50% or even just like 20%, okay? And that you could see that their clothes is fitting them loosely, okay? Their clothes is not nicely tight, nicely fitted like it used to be. Their collarbone is protruding, okay? Their cheekbones, okay? You could clearly see that there's been a weight loss, or you could weigh them, take them to the hospital, and then the doctor might say, wow, your dad is losing weight, and then you might say, yeah, doctor, no matter what happens, dad just doesn't want to eat. Okay, so that's one of the major things. Okay, that's one of the things that we would look at for. Like, we would ask you, okay, the hospice nurse would come to your home and say, okay, so your dad used to weigh 185, let's say. He weighed 185 4 months ago, and today he's 100 and like say he's 120, okay? So that's like, a big difference. All right. Or say he used to weigh 185 and then now he's like 160. Okay. So yeah, the weight is something that's really, really big. Now, I also want to say that to qualify for hospice too, the patient has to be most likely have to be incontinent, okay, have to not be able to talk 6 to 10 intelligible words in a day, okay? It's like word salad, okay, nonsensical words, all right? Not able to walk by themselves, okay? Or somebody who used to walk with a walker and now has to use a wheelchair. All right, I have my little notes here. I'm looking, I just want to make sure that I cover the things that I want to cover. The patient is not able, your loved one's not able to dress by themselves anymore, okay? They're not able to take a shower. They're not able to bathe themselves, okay? Those are all things that would also to kind of be mindful of, okay? All right. So as I mentioned, one of the major things would be the not eating. The other thing is infections, okay? If mom or dad are getting frequent UTIs, urinary tract infections. If mom and dad is getting frequent UTIs to the point where, we keep on having to bring dad to the hospital, bring dad to the doctor's office, and he's always on antibiotics, okay? Or if like dad has a pneumonia, okay, and then where he needs to be treated, okay. So these infections, okay, is another big criteria. Another thing that I'm thinking of also is the skin. The skin has pressure ulcers, okay? Pressure ulcers stage 3 and above. So for example, because your loved one, okay, is no longer able to walk around, therefore he or she is spending a lot more time in bed, okay? And because of that has taken a toll on the body. So the skin starts to break down, resulting in pressure ulcers, okay? So having pressure ulcers, having wounds is also something to look out for, okay, when it comes to the major diagnosis. Another thing too that the hospice nurse might look at is, frequent hospitalization, frequent visits to the hospital. Okay, say dad has gone to the hospital 4 times in the last 2 months. Okay, dad has been hospitalized, 2 times in a month. All right. And that also, your loved one no longer able to recognize you. Okay, you could say, hi dad, hi mom, and then they'll just kind of give you like a blank stare, so that goes along with the nonsensical words, word salad. And as you can see, the reason why I mentioned that having a diagnosis of dementia is tricky, in the beginning of the video, I mentioned that is because some of these things can improve, and they do improve, especially when you put somebody under hospice care, okay? So when somebody is under hospice care, because of all the great care that they're gonna be receiving from the doctor, from the hospice aide, from the physician, from the hospice physician, it's very well likely that they might start to gain weight. Okay, dad could gain weight. Dad's skin will absolutely improve because the hospice nurse, we could come into your home 3 times a week, okay, 4 times a week if it's needed, or even daily. I've had some patients where I needed to see them every day because, they have daily wound care. So because, we are treating the wound, okay, that skin is improving. Okay, so dad is eating better, gaining weight, skin is improving. The other thing is that, because the nurse is there to be proactive, okay, dad don't have to go to the hospital anymore. So the amount of time needed to go to the hospital will decrease. Okay, if mom or dad has an infection, for example, if mom and dad has a UTI, okay, the hospice nurse can come into the home, take a sample of dad's urine, bring it to the local hospital, okay, have, the hospital will test it to see whether or not dad has a UTI. If it's true, okay, rather than you, the caregiver, having to take dad to the hospital, the hospice nurse will communicate with the hospice physician, and they will and the hospice pharmacy will deliver the antibiotic, the proper antibiotic based on the organism that's in the urine, okay? So the medication will be delivered straight to your home so that you can administer it to dad, and that will save you a trip to the hospital. Same thing, if dad is diagnosed with pneumonia, we can also treat it in the house. Okay, so those are all great benefits, guys, of being under hospice care if with your loved ones having a diagnosis of Alzheimer's or dementia. That being said, guys, keep in mind also some of our dementia patients, okay, have graduated. Yes, there is such a thing. You can graduate out of hospice. because like I mentioned, your loved one is doing so well, is receiving exceptional care, that Medicare will say, well, they no longer qualify, because every 3 months, okay, every 2 to 3 months, it depends on your certification period, but we have to show evidence, the reason why the patient still needs to be under hospice care. And if we don't have enough proof, we have to graduate your loved ones. But your loved ones can always come back under hospice care, you see? But it's just that, they have to graduate. They have to be taken off of hospice care for now. All right. Does that make sense? Okay. So if you have any questions, please post a question. I mean, like I said, there are other criteria. There's other circumstances. There might be like other criterias and requirements. Okay, but these are the ones that are most common that that I've had experience with. Okay. So please like this video and share. Okay. Share a comment, let me know what you think. I would love to hear your experience. Okay. So thank you so much for watching this video. Thank you. I love you with the love of Jesus Christ, as always. Duns, beautiful people. See you in the next video. Take care.